so there's a couple of things. The first thing is that there's no question, if you look at studies that have been done, what studies, if you say, I want to know, has this been tried in research and do we have good data to support it and this kind of stuff, cognitive behavioral therapy is your therapy, because data has been obtained many times over that CBT, cognitive behavioral therapy, which I'll explain what it is in a second, is highly effective at treating depression and preventing depression from happening again. So what is cognitive behavioral therapy? You know it, you just don't know you know it. When you've heard, if you get thrown off the horse, what do? The thing is to get back on the horse. That's cognitive behavioral therapy. Because if you get back on the horse, your anxiety will eventually come back down again, and so you'll be able to ride. Incidentally, if you get back on that horse and you're on benzos like Valium and the like, your anxiety won't come down because it's already being blocked, which is why CBT doesn't work with benzos. But having said that, that's an example of CBT, but CBT is something you learn over 6 to 12 weeks. So you don't just keep going forever. You learn its techniques, that you learn how to change the negative thinking and catch yourself making these assumptions that are not actually accurate. And then once you learn that, you're done. And now you've got the tools. It's not like, how long was I breastfed, and trying to get into your head about everything that ever happened to you. So CBT has a lot of data to suggest it's highly effective. Having said that, a lot of people get a lot of benefit from other types of therapy, whether it's, psychodynamic therapy, where they do talk about their upbringing and all this stuff. And a lot of people have a great benefit from it. And I'm not saying that it isn't good. I'm just saying we don't have the data for the kinds of therapies outside of cognitive behavioral therapy. That's just where we've had the best research done.